Alternative medicine isn't new. Naturopathic treatments and remedies have been around for centuries. Millions around the world trust them and consider them an important part of their medical health and well-being. But does that mean it's a healthy solution to conventional, science-based medicine? Joining us now for more on that, in Edmonton, Alberta, Timothy Caulfield. He's professor in the Faculty of Law and the School of Public Health at the University of Alberta. And Timothy, we're happy to have you back on the program. How are you doing tonight?
Good, good.
Excellent. I want to start by reading something that you wrote that was picked up in one of the newspapers on the government's decision to grant regulatory status to the naturopathic doctors in Alberta and create the College of Naturopathic Doctors of Alberta. Here's what you said. The granting of regulated status may seem a relatively benign political act. It will lead to more standardization and, I guess, promote safety. However, it may also foster a misunderstanding about the services provided by these practitioners. It may create the impression that the therapies are supported by good science. It casts a veil of legitimacy over the work of naturopaths, and one could argue, implies that all services that are offered are efficacious. Okay, here's the question. Do you feel that naturopathy is not entitled to the legitimacy that regulated status implies?
Okay, I mean, look, I know, as you pointed out at the beginning, that complementary alternative medicine is becoming increasingly popular, and many people are satisfied with the kinds of services they receive from naturopaths and other CAM providers. So I recognize that, so I know I'm going to come off like the grumpy skeptic. In addition to that, I recognize that there are a whole bunch of reasons to regulate, safety being one of them. It's not just about promoting a field or making statements about whether a treatment is effective. There's lots of reasons to do that. But despite that, I am worried that in this era of evidence-based medicine, at this time in history when we are trying to push towards gathering more evidence about the effectiveness of healthcare, that by regulating these fields, and in some respects more concerning are the comments made in conjunction to the regulation by the Minister of Health. By regulating this field, I am worried that it sends this message that these treatments are efficacious. And to back that up, as you know from the article, and I've done this elsewhere, I used homeopathy as the example, right, which is a very common remedy provided by naturopaths. And I did that for a couple of reasons, and some people got angry because they thought it was like shooting fish in a barrel. It's such an obviously crazy kind of remedy. In fact, I even received some emails from naturopaths saying, look, it's not fair. Naturopathy is more than just naturopathic medicine is more than just homeopathy. But I thought it was a good idea to use homeopathy, and the reason I did it for a couple of reasons. First of all, look, it is extremely common, and our own research has shown in Alberta it's the most advertised treatment associated with naturopathic medicine. In addition to that, it's taught at the schools, the naturopathic schools. It's on naturopathic websites of the associations, etc. So it seems like a fair target. So why do I think that homeopathy is sort of pseudoscience? Well, first of all, the whole idea behind homeopathy is ridiculous. This idea of ultra dilution, right? The idea that you take some kind of substance, whether it's mercury for ulcers or something, and then you put it in water and you dilute it to the point of non-existence, and then the water holds on to the memory of the mercury, and then that's going to allow you to cure. I mean, there's no evidence to support that idea. And why isn't the water holding on to the memory of the fish poop or the memory of the glass that holds the water? I mean, there's so many. And so it's ridiculous from a scientific perspective on a number of levels. So this isn't a vaccine. This cures like idea is not. It's not like a vaccine. There's no active substance in the water. In addition to that, yes, there's been a whole bunch of studies on homeopathy. There's just been a ton of them and of varying quality. But the best evidence tells us it doesn't perform any better than placebo. Yeah, there are a few studies out there that raise some interesting questions that look like it is acting better than placebo. But even those studies, the effect size is tiny. It's tiny. So to hang a whole profession on these tiny little effect sizes seems ridiculous. But look, I believe it's no better than placebo. And many organizations and many systematic reviews have shown this. Now, the systematic reviews that look at the best evidence have shown this. You know, there was the 2010 parliamentary report from the UK that got a whole bunch of attention that, you know, they said, look, it's ridiculous, homeopathy doesn't work, it shouldn't be funded. There was a very recent statement from the American Cancer Society, really just a couple of weeks ago, that cast and questioned the entire value of naturopathic medicine, but also highlighted homeopathy. So I'm not alone, and this is a really good example of, you know, a very common procedure provided by naturopaths that does not have real scientific evidence to support it.
Okay, jumping in here, Timothy.
Colon cleanses, I could have used other ones.
Jumping in here for a second, that was a very long and very thorough answer. I'm going to invite you, and in fact all of our guests who are going to join us soon, to be a little less long and a little less thorough so that we can cover a lot more ground here. But I do want to follow up on this. Somewhere in that answer, I think you did acknowledge that it does have some efficacy for some people. And if that is the case, what's the harm in conveying upon it this added level of legitimacy, as you've referred to it?
Well, I think that the benefit that most people get from it is placebo effect, right? And there's no evidence, in my reading of the evidence, of the scientific evidence, that it's anything other than placebo effect, nor how could it be. So is it, I don't have a problem if people want to use homeopathic remedies, but they should go in with their eyes open. They should realize what the evidence actually says. And this is not science-based, so don't claim it's science-based.
Okay, don't claim it's science-based. However, some of it seems to work, right?
It works largely, I think, because it's of a placebo effect. Look, I tried to OD on homeopathy once. I just gobbled as much as I could to try I've tried do that with anxiety potions. I've tried it with I've tried to OD on homeopathic sleep remedies. Look, this is either water or sugar pills, right? So, of course, the concern is if they're taking this instead of an active agent that they really need. There's unclear how often that occurs. But if people, I'm concerned in this era of evidence-based medicine that the government is legitimizing this kind of practice as evidence-based.
Okay, understood. You've given us a lot to think about here, and as a result, we want to invite 3 other people to join the discussion and have their way on this subject as well. In the nation's capital, we welcome Dugald Seeley. He is a naturopathic doctor and director of research at the Canadian College of Naturopathic Medicine. And with us here in studio, Heather Boone, professor in the Leslie Dan Faculty of Pharmacy at the University of Toronto, and Dr. Joshua Tepper. He's a family physician and vice president of education at Sunnybrook Health Sciences Centre. Welcome to you two here in the studio in Toronto. Dougal, it's good to have you on the line from the nation's capital, and I guess I should start with you. You heard a lot there from our guest in Edmonton, Alberta. Pick up on something and, I guess, respond as you'd like.
Okay, thanks very much, Stephen. I guess one thing I'd just like to state off the bat is I'm a scientist as well as a clinician. I'm a naturopathic doctor who's trained at the Canadian College of Naturopathic Medicine. It's one of 7 accredited colleges across North America with training, which is a 4-year program, which is a full-time program, which consists of 3 years, mostly didactic, and then the 4th year is a clinical internship. Mr. Caulfield points out the issue of the topic of homeopathy and goes to that very quickly, and he rightfully pointed that out as an easy target. I guess I want to make the point that naturopathic medicine is a constellation of many different types of complementary and alternative medicine practices, which does certainly include homeopathy. And I think there is a role to play for homeopathy in certain situations, but I really would rather that if this debate is to be about regulations for naturopathic medicine, that we don't get sidetracked entirely around homeopathy, because there is a lot of issue around the scientific plausibility of it, and I understand there's a lot of difficulties there. My basic training is in chemistry, so there's, however, that said, there are specific situations where people who are good clinicians who I trust very much use it to great effect, and it's a very gentle, non-invasive, non-toxic therapy, so it can be used with efficacy in certain situations, and I don't think we understand fully the way in which that does work, and I really don't want to debate the science of homeopathy here. That said, I'd like to go to the issue of regulations for naturopathic medicine, and I think that there is a very strong case to be made for that, because it is in the public interest. We know that through regulations, there is a way to follow up and ensure that practitioners have a standard of education, a standard of continuing education, and a process through which the public can actually go to a regulatory board, make a complaint, bring forward an issue, and that there's a way of retaining the standards for the profession.
Let me ask you this, though, Dougal.
Definitely. Yes.
Does the attempt to regulate what you folks do confer upon you a legitimacy that obviously those in the science-based medical fields feel you're not entitled to?
Well, I would first take, I guess, to the point that against us not being a scientific-based discipline. I think that we very much are a science-based discipline. A lot of natural therapies are the basis for many of the prescription medications that we have now. We've seen much evolution in medicine over the years. We knew conventional medicine used to provide mercury, used to do bloodletting with leeches, although I understand in some fields that's actually come back. But that being said, I don't think we should distinguish necessarily between what is science-based medicine and non-science-based medicine. Certainly there are research is the way through which we can legitimize and actually identify what are credible therapies, and that can be applied to any different type of medicine, naturopathic, allopathic, homeopathic, whatever you want to call it. We're looking for good medicine for public, and yes, I guess to address the point, there is a legitimacy that's provided through regulation, but there's also a process through which we can ensure that people are getting good care that way as well.
Okay, let me follow up on the regs angle here. I got Professor Boone in the studio with me here. Naturopathic doctors in the province of Ontario are already regulated, if I understand that properly.
That's correct, yeah.
Can you give us a brief explanation of how those regs change the scope of what naturopathic doctors can do as opposed to what is currently in place?
Sure. So all healthcare providers are regulated province by province. Naturopathic doctors are currently regulated in Ontario and a number of other provinces. They've just become regulated in Alberta, so it's a little bit of a different situation where Tim's coming from.
Okay.
But in Ontario, they've been regulated since 1925 under the Drug List Practitioners Act. And in the 90s, Ontario changed how it regulated a lot of different healthcare providers. And in that change, it was decided that the naturopathic doctors would stay under their old legislation, but that they would be re-reviewed and either included under our new legislation at some point in the future, which is what we see happening now, or deregulated. And there were a number of public hearings, a lot of discussion about what was to happen. The final decision was to regulate them under the Regulated Health Professions Act, which is the same umbrella piece of legislation that regulates all of our healthcare professions in Ontario. So doctors, nurses, pharmacists, all of us are regulated under the same umbrella piece of legislation.
That doesn't mean they can do what doctors can do, though.
No, we each
Medical
have our
doctors.
own scope of practice, and we each, the way it works in Ontario is there's a set of what are called controlled acts. So these are things which only a regulated healthcare professional can do because they're dangerous if they're done by someone that doesn't have proper training. And what happens is with each profession, we have the option, each profession identifies which of these acts they need to do to perform their daily activities, and there's various hearings and a process to decide whether in fact they'll be granted that controlled act. So the discussion around naturopathic medicine was which, if any, of these controlled acts should they have. Physicians can do almost all of them, but not all of them. And pharmacists, for example, we can dispense prescription drugs.
You're actually getting more power under this government. You've been given more power to do more
Exactly,
things.
and we see that, well, that's certainly something we see under this whole government, is that we see a broadening of scope of practice. We see generally changes in legislation which allow practitioners of all types to practice to the fullest extent of their scopes of practice. And so I think that this regulation of complementary alternative medicine is consistent with those other regulatory decisions.
Okay, let me follow up with you now. If I heard right, this whole field in the province of Ontario has been regulated for almost 90 years now. Is that right? Going back to 1925, is that right? I heard that right. All right. You, on the other hand, were Assistant Deputy Minister when some of these new regulations were proposed, is that right?
When they were moved in under the Regulated Health Professions Act. That's
Under
right.
that, okay.
At the same time as homeopathy, traditional Chinese medicine, kinesiology, as well.
And what was the rationale for doing that?
You know, I think it has a lot to do with safety, and safety for the client, the patient. people go and seek care from a number of different providers. And actually, just to correct a small point, not all healthcare providers are regulated. Many are not. Paramedics, for example, are not. Many of the people that you seek care from at a high quality of standard are not actually regulated. Many are. Many professions are, such as the one specifically that Heather listed, but not all of them are. And I think the thinking here is that, at least within some communities, more and more people are turning to different types of providers for care, and it's about ensuring public for the safety. The reason you regulate a profession is to help provide safety for those who seek care, because, as you know, it's a time of tremendous vulnerability. You have questions, you might be ill, you might be in pain, it's uncertainty, and regardless of that provider, when you turn to somebody else for that help in that healing relationship, there's an imbalance of power.
You're trying to weed out the kooks, in other words.
Well, there's an imbalance of power, and you're protecting the patient. And
from being abused.
Inappropriately treated. Yeah. Absolutely. And that inappropriate treatment could be on a variety of things. And so I think the government recognized that more people are turning towards traditional Chinese medicine and homeopathy. And in the interest of protecting the public and maintaining sort of some protection around that relationship, regulation was moved forward.
But by regulating them, and are you conferring upon them a more legitimate status than they might be entitled, and certainly critics suggest they ought to be entitled to have in the whole healthcare continuum?
I don't think so, actually. My own view is not necessarily. I mean, if you could actually be provocative and say it's a lack of concern about safety and a lack of legitimacy, that means you want to regulate them, that you see a potential risk, and you want to make sure that people are getting good education standards, and that if somebody goes in and is touched inappropriately or treated inappropriately, that there's recourse. So it doesn't necessarily give legitimacy. What I think it does is recognize that, rightly or wrongly, from a person's view, some people are turning to these providers for care, and that needs to be as safe as possible.
Heather.
I think whenever you change a regulation, you need to look at the impacts. And sometimes there's intended consequences, unintended consequences. And my research team, for example, at the University of Toronto, is studying the impact of these new regulations. Because we can all say what we think is going to happen and what patients will believe or won't believe, but the only way to know for sure is to do the research.
How long have you been doing it?
I've been doing it for about 15 years, actually.
On the regulations?
On this topic,
really?
Because we've been looking at why the regulatory process has moved the way it has. We've been interviewing the practitioner groups to try to figure out why they want to be regulated. We've been interviewing patients. We've been interviewing regulators.
Can you tell us what you found so far?
So far, we found that the practitioners in general do believe it will increase their legitimacy. But patients already very much trust these practitioners. And as you mentioned, whether they're regulated under the Regulated Health Professions Act or not, many patients, it won't make a huge difference in their perceptions of their individual practitioners. Will it mean more patients will access these providers? Perhaps, but that's something I can't tell you yet. I'll have to come back in a few years.
Come back when you've got the study done. Timothy, I want you to pick up on that last point, if you would, and that is that whether they're as legitimate as medical doctors or not, there's a trust factor here, and a lot of patients apparently trust whatever is new and different that this segment of healthcare is bringing to the table. Is that a fair point?
Yeah, absolutely. In fact, we're collaborating with Heather on a lot of her work. So, we've talked about this in the past, and I really think that's true. And the other thing we need to pick up on is why are so many people going to complementary alternative practitioners? What's missing from conventional medicine that I don't want to say driving people to complementary alternative medicine, but what do they find appealing about it? And I do think it's the attention that they're getting, the individualized care they feel they get from complementary alternative medicine. I actually went to a naturopath, and I was very impressed, actually, with the professionalism and that attention to my needs. So I think that's important lessons that we can get from complementary alternative medicine. But I am still concerned about this legitimizing the whole field of the efficacy issue, and that's clearly what's happening. I mean, you look at what Minister Horne said when he made the announcement about the regulation in Alberta. He said, "This is proof that the government thinks these treatments are effective."
You're referring to the Alberta Health Minister in that last answer, yes?
That's right.
Okay.
That's right.
I should pick up here with the medical doctor. I've heard this too. Naturopaths listen better than people who've been through the typical med school training do. Have you heard that before too?
I've heard it. I mean, I do.
Do you believe it?
I don't, or I think there's a tremendous work being done. I teach medical students. I teach residents every day almost, or many days of the week. And there's a tremendous focus on communication skills, on patient-centered care, and I think the focus on listening and creating a safe space and understanding is really becomes as part of the core competency of lots of healthcare providers.
Okay.
Do some do it better than others? Absolutely. Is there always room for improvement? Always.
Let's share some numbers here. These are out of the Fraser Institute, admittedly from about 5 or 6 years ago. Good friend of the show, Nadim Esmail, put these out. We've had him on here before. And let's, if we can, bring up board 2 here, control room. In 2006, nearly 3/4 of Canadians had used at least one alternative therapy sometime in their lives. Nearly 3/4. And more than 1/2 of Canadians reported using at least one alternative therapy in the year prior to the survey. Of those who used alternative medicine in the 12 months prior, a little over half, respondents in 2006, had not discussed their use of alternative medicine with their doctor. And I want to pick up on that. Why do you think that is?
I think that's concerning, actually. I think that's a problematic statistic. I think, and it doesn't reflect good patient-centered care. I think one of the jobs that family physicians or any physician does, or any healthcare provider, is you've got to make an accepting space. You have to realize that whether it's what other treatment they're seeking out, maybe whatever their personal situation is, you have to create a space where they can share the information that will let you give the best and most appropriate information. And so again, for me, it's part of my routine sort of work with my patients to ask specifically about what's going on in terms of what other medicines they're taking, what other healthcare provider they're seeing, whether it be massage therapists or maybe even be another family doctor, and I need to know that, or a walk-in clinic. But you've got to create the right environment because that's how the patient's going to be able to fully share what's going on, and you can deliver better care.
But Dougal, when I read that, my inference from that was people are afraid to tell their GPs that information, lest they be I don't know, teased, or somehow the doctor is felt to feel that there's competition for the patient's interest going on out there. Is that an incorrect inference to draw?
I think it's difficult. I think maybe in some cases there will be that perception that the physician, whether it's the family physician or maybe more likely a specialist, would be would sort of poo-poo that kind of thing, or suggest that they don't do it. I think that is a concern that patients have. I know that Heather's looked at a lot of research in this area, and it's certainly a question that we ask our patients at our clinic in Ottawa. We always advocate that they do fully disclose their complementary therapies with their physicians, particularly the oncologists, which is the care that we focus on. But around the concerns for interactions, and that's usually a way to help open the discussion. In some cases, there's not enough time, or perhaps not an interest from the physician to speak to the complementary medicine. I think there's often a lack of understanding, I guess, about some of those therapies. But it is concerning when there's a lack of dialogue, and I think we're trying to work towards a more integrative model of care, where actually going back to the regulation issue, having regulations enables then physicians to have a better trust, at least in the training that that say the naturopathic doctor has around care, so that they may be more comfortable either providing a referral or at least opening up the discussion there. And I think that's what people are trying to move towards, is a more integrative model of care.
Gotcha. You mentioned Heather in the middle of that answer, so let me give her a follow-up on this as well. Go ahead.
Sure. I mean, we've been asking patients this question for about 10 years. Why don't you tell your doctor? And years ago, I used to get more stories about people being afraid of what their doctor would say. But now the most common answer...
Can I just understand?
Yes.
Meaning the doctor would think less of them for going to a naturopath?
Yes. So I've heard stories about physicians saying things like, all you're doing is making expensive urine, and things like that. So, but I don't hear that anymore. What I hear from patients today is, oh, you mean my doctor wants to know that? It never occurred to them that the doctor needed to know that. And so I also teach medical students, and one of the most important things we can teach them is to ask their patients about, your stat was, 50% of Canadians are using these things, so I tell physicians or medical students, not to ask if their patients are taking these things, but to ask them what they're taking, because we know so many of them are, and that opens up a dialogue. I do hear from physicians that then I have a list of things I don't know what to do with. But that's the next step, and we can work with that.
Because physicians don't know about a lot of these
yeah,
other
I mean,
treatments?
it's not part of medical school training. If you have a list of 10 natural health products that your patients are taking, that opens up a whole can of worms. But it's better to know. And then we can do all the evidence-based research to try to figure out, what are these people taking? Are they efficacious? Are there dangers? Do we have to worry about interactions? But the first step is to get the information out there.
Dougal, I'm not sure I've asked you this directly, so let me do it right now. Why do we've heard that naturopathic doctors have been regulated in some fashion in this province for almost 90 years, but now that they are being regulated in a health professions category, which is different from before. And I guess I want to know why naturopathic doctors want to be included in the regulated health professions now.
That's a good question. I guess, the 1925 Act was is an antiquated act. I think the language around it didn't provide very clear instruction to the regulatory body. There's been a regulatory body that's been in existence. But I think they felt that there was a lack of clarity in certain areas as far as exactly what the regs were, and I think that speaks to the difference in language at that time. I'm probably missing some of the nuances there for sure. I haven't been involved in the regulatory process, but
well, let me help with the nuance here, shall I?
Yeah.
Here's
yes,
and I am not a cynical person, for the record, but a cynic would say you're interested in being included in the regulated health professions because it's the thin edge of the wedge to getting recognized on the OHIP fee schedule.
Okay, I think that is not what we're seeking, and there's a bit of a debate within the profession whether or not being covered under the OHIP is a good thing or not a good thing. We recognize that it would be a very difficult issue for the government, considering how much costs are increasing. I think ultimately, if you're looking at a preventative upstream approach that naturopathic medicine espouses, you're going to find cost effectiveness, but that's a much broader debate. So it's never been put forward within the profession as a way to get OHIP coverage. One area is there are sort of more tighter regulations around some of the natural medications that we do prescribe, and these would not be homeopathics, but pharmacological, botanical medicines that may be put into a different list or category as far as being able to provide medications. So one of the concerns was that that would take away some of the medications that we use to benefit for patients, and that was one of the reasons.
Okay,
I'm
Timothy?
sure there's more to it. But.
Timothy, can I get you to follow it? Do you think the financial angle is part of the angle here?
Well, I don't have evidence one way or the other, but of course that's, again, the cynical side of me sees that, and also just the legitimizing that comes with it, right? I think that for sure is part of the story. Again, I just have anecdotal evidence to support that. But I think another important thing to pick up on is this idea that if we regulate it, it's going to, the services are going to become more efficacious or more science-based. And again, we don't have a whole bunch of evidence on that, but our own work has found that it hasn't made a big difference. So we compared BC with Alberta, so Alberta pre-regulation. And the naturopaths in BC were providing homeopathy, colon cleanses, hair analysis, chelation, all of these things that have no evidence really to support their use. And there wasn't a significant difference between the two provinces. So the regulation did not seem, in this case, to make the therapies that were provided any more science-based.
Let me give you the Canadian Medical Association's official position on complementary alternative medicine. Here we go, Board 3, Control Room. The Canadian Medical Association's position is based on the fundamental premise that decisions about healthcare interventions used in Canada should be based on sound scientific evidence as to their safety, efficacy, and effectiveness, the same standard by which physicians and all other elements of the healthcare system should be assessed. So let's get into this. Josh, do you think that naturopathic doctors are held to the same standard as conventional doctors in terms of evidence-based medicine?
I think we have to be a bit careful, because I don't think evidence-based or not evidence-based is what's driving regulation or the decision to regulation. I'm not even convinced it's necessarily about legitimacy either, or necessarily about funding, although, as you say, it could be the thin edge of the wedge. I really think it goes back, looking through a government lens, about what is in the interest of the patient, and how do you create a structure around, again, a difficult or an important interaction around healthcare that really allows some protection for the patient in a time of vulnerability. And I think that's what's driving the decision. I don't think the governments go through and analyze every article, as I think Timothy's done very thoughtful research on, and probably can speak to this, about, is there 10 articles pro and 5 showing placebo, et cetera? I don't think that's what drives it. Is a significant number of the public going into these places, seeking out what they see as healthcare, what they understand as healthcare, putting themselves inherently, as we all do in times of difficult pain, emotional, physical, worry, in a vulnerable situation, is there recourse there to a set of structures that will govern that interaction, that will help put some quality controls around the education of that provider, and will help keep other people without that level of preparedness or without recourse from simply calling themselves or putting themselves in the same way. So I don't think the government focusing on regulation is thinking about, is this evidence-based or not? I do think certainly the medical profession is very constantly trying to improve, as Timothy says, the evidence-based around it. Not everything we do has perfect evidence, but I think it's a constant drive to improve it and to change it and to do more study and to do more research.
But you're a family doc, right?
Yep.
How many years of training to become a family doc?
A lot. Yeah, there's undergraduate, and then there was medical school, and then residency, and then some additional training in areas that I was interested in, like obstetrics.
Right. And then you've got people who go to you for treatment. You have people who go to naturopathic doctors for treatment.
Correct.
They don't have the same, I'm not going to use an adjective here, let's just use it. They don't go for as much training as you do to get the letters after their name, right?
To be fair, though, we have a large number, neither do the massage therapists, where some of my patients go to. They have a very different training route.
But they have a role.
The route to physiotherapists also have a different route. The route to pharmacy is also a different route. And they have different educational streams and different roles to play. The fact is, at the end of the day, patients go to all of these people. They're seeking and expecting a certain level of professionalism and a certain amount of safety and a certain amount of standardization in the care they receive. And we know that patients, I can say the evidence supports this, and you should really take an aspirin a day based on a whole bunch of really good studies, and they'll make an individual choice.
Right.
And I've shared the best evidence, and it's not my job to judge or to turn them away or say, don't come back. In fact, come back and we'll talk about it, and we'll just continue to interact on this. And that's really what you want to do, is create that safe place.
Okay, can I get, since you are not a GP?
No.
And you're not a naturopathic doctor.
I am not.
So you are uniquely, for this program, well positioned to answer this question. Is there a turf war going on here between these two professions?
I don't think so. I think they provide very different services. And I think, well, that's the ideal, right? Dougal talked about integrative care. We've talked about complementary care. And I think those are system questions and issues that need to be developed or questioned. I think from a patient perspective, one of the things you have to think about is, okay, what if we don't regulate them? If we don't regulate them, these practitioner groups, and something goes wrong, the patients don't really have very much recourse.
It's the wild, wild west.
It's the Wild West. Unless the practitioner has done something criminal, it's very difficult for a patient to have any kind of recourse. You can sue them civilly, but there's not much you can do. One of these umbrella regulations set up is a whole way to assess patient complaints, to sanction providers, and that I think is what regulation does provide protection for the patients.
It is one of the things that also creates a difference from moving in from the older model, right. The Drugless Practitioner Act, under this new model. So you could say, well, you were regulated under one piece. Now you're regulated under another. One of the differences is the types of structures that are in place under what's a more modern piece of legislation.
Dougal, do you want to come in on this?
Yeah, I guess just to speak to the issue around evidence and whether that is the impetus for regulation. I would agree that's not the tie there. And I think we could talk about any different types of medicines and the level of evidence that exists for that. There are certainly a lot of therapies that are provided by naturopathic doctors that are not, very well researched. And And then there are some that are quite well researched, and there's a very wide range. And I think in the medical practice would also say the same thing. A lot of surgical practices don't have randomized trials behind them. It's more based on common sense and clinical experience. That said, we know what good medicine is in many cases. I am very much a proponent for strong research methodology to assess the effectiveness of different medicines and also its risks. And we need to develop that evidence further.
Timothy,
that said, yeah. No, that's fine.
Okay, well, I was going to say Timothy's far too polite to say it, but I get the sense, just from hearing everything he said so far in the program, that you probably believe, even if you're not saying it directly, that a lot of this is quackery and doesn't deserve to be treated the same way as good old-fashioned science-based medicine.
Oh, I didn't want to use that word, but
do you believe it?
I believe a lot of the things that are under the umbrella of naturopathy, and there is huge variation in practitioners. I want to acknowledge that. A lot of it is, let's call it quackery. I mean, colon cleanses, it's very, very common. Google naturopathic medicine and colon cleanses, and you'll find clinics all over Canada ready to do that. Not a stitch of evidence to support that. There is, it's dangerous. Same with, hair analysis. I mean, we could go down the list, right? And this is the common stuff. This is the things that are, when I went to a naturopath, I got handed a homeopathic solution, and I got handed some supplements. And it was very expensive. It was over $250, and both of them are completely useless. No evidence to support them whatsoever. And so, I do worry that this legitimization kind of that comes with regulation does allow this kind of magical thinking to kind of have some legitimacy. Now, having said that, I know that there are many naturopathic medicines that are practitioners that are sort of pushing towards more of an evidence-based approach. I think that's great. I also completely recognize that I'm an equal opportunity skeptic, that a lot of what doctors provide have no evidence either, right, for sure. But look, if naturopathic medicine was evidence-based, they wouldn't do homeopathy, colon cleanses, hair analysis, chelation. I could go down the list, and not a lot's left.
Well, you bring up a good point. We haven't discussed it on this program, but conventional doctors do send their patients off for a whole host of tests, often, which have no basis in anything other than making the patient feel as if they've been listened to. That's another program. We won't have to go into that today. But we got a few minutes left here, and I guess the bottom line here is that whether we like it or whether we don't like it, these two worlds are coming together. And more in the future, patients are going to be seeking naturopathic or homeopathic remedies to what ails them. And I guess my sort of final question for everybody to chew on here is, can these two different worlds work together, Heather, you first, in the interests of the patient? What's your experience tell you on that?
I hope so, because patients are going to use these things, and that's not going to stop.
I hope so isn't, I'm sure they can, though.
Well, I'm not sure they can. They come from very different worldviews. I believe that if we all speak the language of science, and we all put our faith in science, then we can come together. I'm not sure that we can all do that, but that would be my answer.
Josh?
I think if we all put our faith and focus on the patient, then we can do it. We may come from very different places on what science is, what science isn't. Is this science? Is this good science? Is this average science? Is this less than average? But if we put the patient in the middle, we recognize that for whatever reasons that might drive them, better communication, a failed experience in another part of the system, for whatever those reasons are, they are seeking out a variety of different providers. And that doesn't matter as long as the goal is to provide the best care as part of that patient's healthcare team, then I think we can do it. If we focus on ourselves first, or is this study going to be better than that study, or et cetera, it's going to be hard. But if you say, listen, my job in the path of care for this individual is to be as constructive, as open, to ask the right questions, then I think we'll have success.
Dougal, what's your view on whether these two worlds can coexist?
I think inevitably they have to, and we are moving more towards that. I really like Dr. Tepper's point about the patient and putting them at the center. They are the ones that are really interested in the integrative model. They want to hear about these things. They want to learn about nutritional approaches. They want to see, the evidence. They're also very interested in high quality research and data. So I think the public is actually very well informed from that perspective. It's encouraging from the research angle. I find the best collaboration actually happens amongst researchers, because researchers don't really have an axe to grind except for trying to find the supposed truth,
Right.
and or
Follow the
as
facts.
close to be. Yeah, and so I think that's what's driving it. There are disciplines that are moving towards this sort of integrative model, and good people are working together towards that. So
Okay,
I
let
think
me
we're
jump
getting
in,
there.
Dougal.
And
Forgive me, because we're
Yeah.
down to our last 30 seconds, and I want to make sure
Sorry.
Timothy's got time to address this as well. Can you work together, Timothy?
I like this last comment about researchers. I don't think they can, for the reasons that Heather pointed out. I think that they just come from different worldviews. One's a philosophy, one's more science-based. But you know what I'd like to see? Let's blow it all up. Let's blow it all up. There isn't two worlds. There's one world, and that is a science-based world. And we just pick the therapy that science tells us works the best.
Okay, 3 votes for hope and 1 vote for blowing it up. I got to see where that one takes us in the future. Thanks all 4 of you for joining us tonight for a most interesting debate. Timothy Caulfield in Edmonton, Alberta, professor in the Faculty of Law in the School of Public Health at the University of Alberta. Thanks for being there on the line from Western Canada for us. In the nation's capital, Dougal Seeley, the Director of Research, the Canadian College of Naturopathic Medicine. Dougal, thanks for being there from Ottawa. Here in our studio, Heather Boone, professor in the Leslie Dan Faculty of Pharmacy at the University of Toronto, and Dr. Joshua Tepper, GP and VP Education at Sunnybrook. Thanks so much, everybody.
Support Ontario's public television. Donate at tvo.org.